You're listening to a podcast developed and produced by the Association of Asian Pacific Community Health Organizations, AAPCHO. To learn about AAPCHO, its members, or the principles and values that have guided this organization's work for more than 20 years, please visit www.aapcho.org. Voices from the Frontline is a new podcast series dedicated to spotlighting the unique experiences and insights of the dedicated, passionate people at the helm of AAPCHO's member health organizations. In this episode, AAPCHO's Membership Relations Associate, Grace Sonia Melania, visits Asian Americans for Community Involvement in San Jose, California. AAPCHO President and CEO Michele Lew discusses the importance of not leaving behind legal immigrants as we move forward with healthcare reform, sharing a poignant, troubling story of a recent AAPCHO patient as a perfect example of this issue.
For my podcast interviewing purposes, could you please state your name, your title, and which health center you're from?
Sure. I'm Michele Lew, President and CEO of Asian Americans for Community Involvement, AAPCHO.
So my first question is, on June 22nd, your health organization, Asian Americans for Community Involvement, hosted a press conference with Representative Mike Honda and other local community groups like Healthcare for America Now, Asian Immigrant Women Advocate, CPEN, and a couple of others. Could you tell me a little bit about this collaboration and why it was important for AAPCHO, Asian Americans for Community Involvement, to come together with Representative Honda and these other community-based organizations?
We were so excited to be able to host a press conference in June with Congressman Mike Honda, who's our congressman, and other community organizations to talk about the importance of making sure that all voices are heard in the healthcare reform conversations. We're especially concerned that the voices of low-income immigrants, people who don't speak English, and other unrepresented folks aren't being heard equally in the healthcare reform debates. And we're worried that issues such as health disparities and access to healthcare might not be getting the attention that they need. For AAPCHO, we were excited to work with Congressman Honda because we opened up a community health clinic in the year 2000, and he has been hugely supportive of our efforts. We serve predominantly low-income, monolingual patients, mostly Chinese-speaking, and for them, there may be no other place for them to go for healthcare other than the county hospital and the emergency room. We've had double-digit increases in our patient population without doing any formal marketing campaign. And so we know firsthand that we need healthcare reform in this country to make sure that everyone has access to healthcare before it gets so serious that they need to go to the ER.
So I'm going to move on to questions about healthcare reform and what your thoughts are. So why do you feel healthcare reform is important?
We had a patient just 2 weeks ago come in, and she's an immigrant from Asia. She speaks Chinese. Her English is limited. She's divorced and low income, and she teaches music lessons. She teaches violin to make her ends meet. She came in because she's having difficulty with her vision, and it's getting to a point where she can no longer read the music for the students that she's teaching, and so she's basically teaching from her memory of how the music goes and hoping that the parents and students don't realize that she can no longer read music. After our doctor saw her, we realized that she could get a pretty simple procedure. She has a cataract issue, and if she could get that procedure, most likely she would be fine and her vision would be fine. Because she's uninsured, the waiting time for her to get the surgery that she needs is between 1 and 2 years. And at that point, her condition might deteriorate so that it gets to a point where this surgery is no longer an option. The good news of this story is that we were able to find her some care in a shorter term than that 1 or 2 year timeline, but we really had to scramble. And it's just a perfect example to us of why we need healthcare reform. This woman is a hardworking immigrant who's just trying to make a living for herself, and she just needs a simple procedure. And if we could give that to her, we would avoid having her go blind and be dependent on the government for her care. We just need to take care of these things sooner rather than later. And so that's why we are so passionate about getting involved in the health care reform conversations. We're seeing the patients who I think would arguably benefit the most from healthcare reform, and we want to make it happen sooner rather than later.
What's on your wish list for this healthcare reform bill?
One of the things on our wish list, at the top of the wish list, is to make sure that legal immigrants get access to health care. Right now, there is a 5-year waiting period for immigrants to get access to Medicaid and even children's health insurance. And when we're talking about health care for all, I think we should be talking about health care for all folks who are here legally. A lot of the patients that we see are legal immigrants who've been in this country for 5 years or less, and we want them to be able to get the same healthcare treatment as everybody else. They are just here in this country trying to make a living and provide a better life for their family, and let's do our part to make sure that they don't get sick or need emergency care it's super expensive. I think it's in all of our best interests to get rid of those waiting periods for immigrants. We also are passionate about wanting to make sure there's a public option in the healthcare reform package, which somewhat to our surprise has become hugely controversial. We don't get it. We absolutely need a public option to keep costs down, to provide access to health care for everybody, and I hope that we keep the public option alive on the table.
Thank you so much, Michele.
Thanks for listening to AAPCHO's Voices from the Frontline, conversations illuminating our vision of equitable, affordable, and culturally appropriate healthcare for all. Please join the conversation on our Facebook fan page at www.facebook.com/AAPCHO.